Hey guys, welcome to my channel. If this is your first time here, my name's Alyssa and I am a wound care nurse from Ontario, Canada. I'm a wound care nurse and on this channel I make lots of videos on different wound care supplies, products, and how to use them. So in this video I am going to show you how to pack a wound because it is kind of an art how to pack a wound. You want to kind of fluff it, not stuff it. So if you haven't subscribed already, please hit that subscribe button and hit the little bell notification so you don't miss any of my videos. Once you have all your supplies prepared, you can next prepare your wound base by cleaning it. I normally clean with sterile saline. Okay, so you would flush the wound. Now you would have the person tilt where the water is just going to flow easily out of the wound, flushing it well with the whole bottle. We always use the whole bottle to get out all the grime, bacteria, anything that might be in that wound, okay? So next, I'm going to show you how deep this wound is, okay? So, that's how deep the wound is in my model here, okay? And then there are different products that we can use to pack this. So we have plain packing strip. We have another packing strip that does have the PHMB on it, so it is an antimicrobial. And then for very large wounds, we have the Curelix, which is also a PHMB packing gauze, which is very large, okay? That's for your very deep wounds, very where you need a lot to pack in there. So I have chosen that we're going to just use plain packing for this demonstration. Okay, so it's just opened. We pull the gauze out, okay? And so you're always going to pull out more than what you need. Okay, you can cut it off. Okay, and you can put some saline on this packing, okay, to get it moist before you pack it, okay? And I'm actually going to do that so it stays in here. Okay, so then you're just going to pack it here with your cotton tip applicator. Now you just do kind of like a fan fold back and forth. Now you don't want to stuff it. You want to make sure that you're just lightly fluffing it into the wound. Okay, now we pack wounds because we want to make sure that the wound has something to grab onto to grow upwards towards where the tissue should be. So that's why we actually pack a wound. And there will be a link in the description of another YouTube video of how to pack a wound and when to pack a wound. Okay, so you're just going to cut off the excess. Make sure you always leave a tail, especially if it's just a very tiny hole opening. Okay, so that's there. It's just nicely fluffed in. And then you would put your cover dressing over top of that. So as a nurse, there will be times that you come in to wounds that kind of look like this. So this one's circular, but they can be just a little slit in the skin, and they actually go in quite deep. So initially, when I go in, it just looks about 2 centimeters. Okay, but if I start probing around, which you should always do to make sure, I can actually get in quite deep, and I'm not even hitting hitting a base yet, okay? So this is also something that I am not going to flush, because if you cannot touch the bottom, you cannot get the fluid out. So you never want to flush when you have a tunnel like that you're not hitting an end to, okay? So in this case, you always want to look for those tunnels, encased tunnels. You never know where one might be, okay? And you want to make sure that you're packing that fully. So again, I'm just going to use my sterile packing here. And I'm going to keep it attached this time, just because I'm not sure of how much packing I'm actually going to use because of that tunnel. Okay, and you're just going to start packing and fluffing, trying to get way into the back, pulling it way into the back, because you do want it to just be fluffed into there, not jam-packed. Okay, so once you get a good base and bring that all the way in, okay, and you're just going to keep doing that, fluffing it gently, touching all the nooks and crannies in there, because you want to make sure that the packing's touching every surface so it can close, but we want to make sure that we get all the way into that very, very far tunnel so that it doesn't close and form a pocket back there, or they're just going to form another abscess. So then you'll have a big mess in there. Okay, so like I said, just nicely fluff it into the hole. Okay, and with holes like this, you want to make sure that you have a good tunnel or a good tail, because sometimes as the wound, people move around, it kind of gets sucked in a little bit. So I always just leave a nice long tail and then put the cover dressing over top of it. So I do hope that this video really helped you learn how to pack a wound, and I hope that if you haven't already, you do subscribe to my channel to help this channel keep going, and do check out all my other videos, because I do have a lot of great information out there to teach you all about wound care.